That is a great question. Okay, so what you're experiencing may be something like Prinzmetal's angina. Prinzmetal, that was the name of the doctor that described it first. And what it is, it's the stress response. It's an emotional stress response causes a release of adrenaline. Adrenaline causes vasoconstriction, the constriction of the blood vessels, narrows the blood vessels going to your heart so that you have less blood flow to your heart. Your heart's going, hey, wait a minute, I have to work here and I'm not getting enough oxygen. And your heart's building up lactic acid.
Let us know when you were here. You can go ahead and post it in the chat.
The purpose of this program is to build me up.
Yeah. How we doing?
All about me.
Tell us something interesting about yourself. How about that? I want to know.
There you go. That's good. We got quite a few of you on here, so go ahead and comment there in the chat. The Q&A is also available. That is for your questions. So any questions you have about the things that we're talking about today, or questions about how to keep your heart healthy, please post those there. It's just the easiest way for us to navigate. And then YouTubers, Facebook, hello. We are excited that you are here. There should be a link for you to click, but if not, you can go to bartonwebinar.com where you'll find more information about these webinars, our recordings, our most asked questions, and all of our products. So bartonwebinar.com. If there is something that you decide today, you're like, I really want to get that, or I really want to try that, you can use code webinar25. It's one word. As I hold up two fingers, it is one word, and you will save 25%. So quite a few of you on, which is wonderful. Booty, Madden, hello. Robert is here. Butch is back 2 days in a row. Butch, awesome. Ryan, 2 days in a row as well. How are you? Marion is back. Gerald, hello from St. Paul. Ted is here from Alaska. Trisha, North County, San Diego. And Barry is here from North Carolina. Hello, everyone. Welcome to the Healthy Heart webinar. We are excited that you're here today. We are on episode number, Leslie, 39. I was going to say, did we just do 38? It must have been.
So last week was 38.
Okay. So yes, we're on 39. Awesome. So
Roy Ford. Roy Ford lives in Colorado and he was a Navy diver. Wow. That must have been tough.
Oh, I love to dive.
Wow. That's awesome.
That's right. You're a scuba diver, huh, Cheryl?
Yes, I am. My husband is a master level, so right beneath instructor. So he can do rescues and he can teach a little bit, but we love to dive.
Wow.
Nothing I say is going to sound that cool anymore. So I don't really know what to say about myself, but we'd love to hear from you guys. We want to hear what is something interesting about you. All right. Okay. Who else do we have?
Lloyd from Hershey is back again.
Nice. Hey, Lloyd. Great. Connie is back as well. Very, very awesome. All right, guys. So before we get started today, I just want to let you know that Dr. Saunders is not your doctor. So before you implement anything that we talk about today, make sure you chat with your medical professional. All right. And with that, we're going to dig into some questions. So I have got some that were emailed, but guys, I just want to point out that most of our questions have to do with this Healthy Heart Solution Kit. So this is the program. These are all my little post-it notes for things that I want to remember. So that's why those are there. But Dr. Saunders and the Barton team put this together for those of you. Well, Dr. Saunders, tell us, why was this created? Who is this for?
Okay. So the number one cause of death in the in the developed world, at least, is heart disease, and we call it heart disease. It's vascular disease, and it's actually very specific to a certain type of vascular disease, and this is a small vessel disease or medium vessel disease, actually, because the very small vessels are less affected, and the very large vessels are less affected, and so these are relatively large vessel disease. So. There is a lot of information that's available and it's not getting out to the public. People are not getting this information and they're being told by professionals that there's a cholesterol problem, and the cholesterol myth has been debunked for many years now, but it takes about 20 to 30 years before the science before the clinical medicine catches up with the science of medicine. So the science way back 20 years ago, even longer, has said, oh, look, cholesterol is really not the issue. And yet we're still hearing that. And so we thought, well, how are we going to get this out? How are we going to teach people about how to really take care of their heart and prevent heart disease instead of having these risk factors that aren't really risk factors? One of the things that drove this was a study done in England. They took 500,000 people and put them into a database, like everything in their demographics, where they live, their race, where they came from, their religion, then all of their blood tests and all this. They put all this information in, and the ones that had heart attacks and whatever. So then they asked a bunch of questions of the AI, the computer, and the artificial intelligence just spits out what it finds, and it doesn't have an agenda. And that's the difference. If you go and do a medical study, somebody is paying for a study, and they're paying to get a certain outcome. So the person doing the study, in order to get paid, has to have that certain outcome. So they say, how are we going to design a study that looks like this? So for example, rabbits get heart disease from cholesterol. They build up cholesterol in their arteries. So they said, we'll use rabbits because they do. Human beings don't, but rabbits do. So if we want to show that cholesterol causes heart disease, we'll use rabbits. And so that's how they do research now, is to get a certain outcome. So the AI computer doesn't care. There's no agenda there. It just goes, this is what I see. Blah. These are associated. These are not associated. So this whole study came out with, and they asked the question, so what are the associated risk factors for heart disease? And they were all like weird things, like mental illness causes heart disease, like severe mental illness, people with schizophrenia and severe psychosis, those kinds of things. People that had socioeconomic status was really big in there. They had race, was where you lived in London made a big difference. Blood pressure was way down on the list. And the second to the, or third to the last one, number 46 out of 48, was LDL cholesterol. And here we've been hearing that, oh no, your cholesterol is high, you're going to die of a heart attack. There is pretty close to zero relationship there. So how are we going to get this information out? So we wrote the Healthy Heart Solution Kit. And so all of these weird risk factors that are actually the real risk factors are the ones that are in the kit. So you read through the kit and you go, what the heck? Why all this stuff about stress? Oh, because guess what? If you look at the top 5, then you look, stress is an issue. There was a study done on rabbits, actually, many years ago, and they were giving these rabbits, they were feeding them cholesterol like crazy to see if they can get their arteries to clog up. And there was these groups of rabbits, they're all getting the same food and everything, but this one group had really low deposits in the arteries. Their cholesterol deposits were really low in their arteries. They were the ones without heart disease, and all of the other rabbits got a very high level of heart disease, except for this one group of rabbits. And they're going like, what the heck? Is this a different breed of rabbit? No, it's the same. They're all like siblings practically, or cousins at least, from litterers that are pretty much the same. So there didn't seem to be a genetic effect. and so they went to, they looked at who was taking care of the rabbits, and the lab assistant, they were asking the lab assistants, were you feeding them properly? Were you giving them food on time? Were you giving them the amount and all of that stuff? And all of that stayed the same. And they found that this one group that had very low level of heart disease was from the same lab assistant. And they're going, okay, what are you doing differently? She goes, nothing. I'm doing everything according to protocol. I'm giving him exactly this, exactly that, exactly according to protocol. And they're going, okay, let's see. Let's do it again and just watch what everybody's doing. So they found that this lab assistant, she's feeding her rabbits everything, giving them the right food and everything. But every time she'd come around to feed them, she'd take them out of the cage and pet them and love them, and then put them back. And then she'd take another one out and pet it and love it. And, oh, you're so wonderful, and put it back. And so she was loving each one of her rabbits.
Mm.
And that's why they didn't get heart disease.
Mm.
Isn't that amazing?
Yeah.
And this is a rabbit, for heaven's sakes. But that connection, or that just being touched and petted, was enough to prevent them from getting heart disease. So why did we put it in our book? Because it's real. This is a real risk factor. It's not like cholesterol, some stupid risk factor. It's actually real. So that's why we wrote the book. Does that answer your question?
That was awesome. That was great. All right. And that's it for today, folks. That was really good.
Read the book.
Yeah, that was awesome. Here's the book again, just in case you're wondering, and you can find it at bartonwebinar.com. I did post that in the chat, and we'll talk more about that as well. But that was so good. I was even thinking about what is it called? Broken heart syndrome.
Oh yeah, broken heart syndrome.
I mean, that's a real thing. That's a real thing, and we've talked about that in some of our webinars as well. And just there's a lot of importance in stress reduction and love and a faith and all of those pieces that play a huge role into our health.
Yeah, they're really big.
Yeah. Okay. I do have a question. Just interesting, you're talking about cholesterol and these kind of things. Well, I had gotten an email from Dave a little while back, and maybe he's now heard some things, but he said, my cardiologist says I have 0 calcium and minor plaque. They claim I have to be on cholesterol and blood pressure medication for life. I'm very active. I eat healthy, and I have recently started fasting. Can my minor plaque be reversed, and can I get off my prescriptions?
Okay. First of all, the question is, do you need them at all? Do you need the prescriptions at all? So there was research, there was a study done, and it was published, and it showed that people who have 0 coronary calcium score of 0 do not need any cholesterol lowering medications. And as a matter of fact, I don't recommend them for anybody because cholesterol lowering medications do more harm than good. And if you look at the big picture, you find that low cholesterol causes more death than high cholesterol. But the cardiologists are very narrowly focused on just cardiovascular deaths, and those actually do decrease with lower cholesterol. But then deaths for other reasons goes up. For example, you increase your risk of Alzheimer's disease when you lower your cholesterol. You lower your vitamin D levels, that increases your risk of Alzheimer's disease. You lower your CoQ10 levels, that increases your risk of congestive heart failure. You lower your hormone levels, so you have less hormonal support. Your pregnenolone, your testosterone, your estrogen, progesterone are all made out of cholesterol. And as you lower the cholesterol, you lower the hormone availability. So you have less hormone support for your body. Besides that, all of your cells require cholesterol to function. Without cholesterol, you can't make a single cell, not even one cell. So if you take the cholesterol out of your body, you just disappear. because there is no body without cholesterol. So you can't reproduce cells if you don't have cholesterol. So as you lower cholesterol, you can't repair your brain, especially your brain, because that's the most important part. But you also can't repair your heart, your kidneys, your liver, and all of the other cells that require cholesterol to be made, including red blood cells. And so you mess up your bone marrow. So since cholesterol is so important, your actual level of cholesterol, we've looked at this multiple times, you can go back to webinars, should be around 220, 210 to 240 is the optimum place to be.
Okay, and Robert had sent in a message as well. It said, I'm interested to know what information there is for reducing lipoprotein A naturally.
Okay. Well, since lipoprotein A is sort of genetically determined, it's not a good idea to look at lipoprotein A. If you should test for it and say, oh, I have low lipoprotein A, then I don't have a concern about that. Or if you have high lipoprotein A, then you should have a concern about that. And because high lipoprotein A, what it does is it binds to clots and prevents your body from dissolving the clots. So you end up with these clots inside the wall of the blood vessel that can't be dissolved because they have all this lipoprotein A attached to them. So, but if you have low lipoprotein A, then you dissolve clots and you repair the blood vessels really easily, and it's not a problem. So you're just much more likely to get this plaque buildup if you have lipoprotein A. So what do? Well, you need to dissolve clots, so you can use nattokinase, for example, if lipoprotein A is high. Lumbrokinase, these are two enzymes that dissolve clots all by themselves, and you can take them orally and actually dissolve clots. That's been shown in studies. You also can prevent clots from happening by decreasing inflammation, making sure your omega-3 to omega-6 ratio, or it's omega-6 to omega-3 ratio. I had somebody yesterday, omega-6 to omega-3 was 2. And this is a woman who is really worried about her health. She comes in all the time and she's always anxious about, oh my gosh, I'm going to die of the heart disease. Oh my gosh, I'm going to have Alzheimer's. And she's 82 years old, and she looks like she's 50. I mean, she really looks young. Her omega-6 to omega-3 ratio was 2.1 to be exact. And she looks great, and she's very active. She dances every day. And she's in her 80s. Anyway, so I think that if you have a very low inflammation and a very good omega-6 to omega-3 ratio, which would be like 2 to 4 would be excellent. And don't look at normals. Remember, normal is not good. It's not optimal. Normal is what everybody else has. That's just comparing you to everybody else. And if you think of 30% of our population is obese and over 50% of our population is overweight, and everybody's dying of heart disease, the number one cause of death is heart disease, then you don't want to be like everybody else, right? You want to have an optimum level. So be careful when you're looking at those omega-6 to omega-3 ratio of, oh, you're 10, you're fine. No, that means you have 10 times more omega-6 causing inflammation. And then omega-3, which suppresses inflammation. So you're going to you're going to make all these inflammatory markers from the omega-6. You want to bring that pretty close to 2 to 1, 1 to 1. 4 to 1's okay, but those are ideal ratios.
Christine had actually sent a message as well about the omegas, and she wanted to know what the benefit of getting that omega oil test would be. What are the results you would look for? You mentioned this in the last webinar, which I think you kind of told us what results we want. But again, maybe just some clarification around the benefit of getting yourself tested.
Yes, get yourself tested. You know what? There are real risk factors and there are fake risk factors. So high blood pressure, fake. Cholesterol, fake. Real risk factors, lipoprotein A, LP little a. That's a real risk factor. Another one is the omega-6 to omega-3 ratio. That's a real risk factor. Stress markers or inflammatory markers being elevated. Those are real risk factors. So working on those is a very useful thing to do. And working on that other stuff is just to keep you busy until you die, because that's what they're supposed to do. They just give you pills to take so that you don't know that you're dying. That's the whole idea. That's what, who was it? Someone from the 1800s, a philosopher from the 1800s said, medicine is the art of keeping the patient busy until the patient either dies or the body heals itself. That's what medicine is all about, just keeping you busy.
For sure.
And, you know, nothing has changed. Oh, it's Voltaire. Voltaire said that.
Wow. That's something to think about. You know, in the beginning of this webinar, we had said, tell us something interesting about you. And Jerry says, Captain Jerry Baker Jr., Vietnam vet. So thank you, Jerry.
Thank
That's
you.
awesome. Yes.
Awesome.
Thank you.
Connie says, hey, I've been watching the heart webinar and I want to order the book and the supplements that are good for your heart. Can I do this online? And yes, you can. You can actually do that at bartonwebinar.com. Again, use that code webinar25 and you'll save 25%. You know what? Let's chat about that a little bit. Let's say someone is just kind of getting started. They know they want to start incorporating some things to get a healthy heart, maybe reverse some things. What do you recommend? Do they need supplements and the book and this and that and this and that? Or what do they need to do? Where should they start?
Well, the book's a good start. You know, starting with supplements is really not a good idea unless you already know what you need. So, for example, if you've done your omega-6 to omega-3 ratio, you don't need all the other ones, the EPA, DHA, ALA, all that stuff. You don't need the details of that. Really, you just need that ratio, because that's where the difference lies, and that's where those different inflammatory mediators or anti-inflammatory mediators, that's where they're created. That's where they start. So having that ratio is the important thing. And if you know what it is, then you go, oh, you know, I'm 10 to 1 omega-6 to omega-3. So I need to start taking some fish oil. Then you start supplementing the fish oil and getting the omega-3s. Why? Because it's hard to get omega-3s. Yes, you're going to eat flax seeds and chia seeds and fish, but you have to be careful with fish. I had a guy who he, in Santa Barbara, he just goes out in the channel and he fishes for swordfish, and so he'll catch a swordfish, and before they're even into the dock, he's got it all filleted and in the ice chest, and he fills up his freezer with swordfish and he eats it every day. And so we did a test on him, and the lab called me and they said, we have a panic value. And I said, okay, don't panic. What is it? And they said a mercury level of 50 times the upper limit of normal. And I'm like, okay, who is it? And they go, this so-and-so. Is he dead? And I go, probably not. Let me talk to him. So I called him. I said, how you feeling? He said, great. Why? I said, where are you? He said, I'm out in the channel fishing. And I'm like, oh, bummer. Well, I have bad news for you. Anyway, so if you already know what you have, that was about the fish. So be careful the fish you eat. You know, don't eat swordfish every day. That actually is a problem for mercury. But salmon is actually pretty good, and mackerel, and the cold fish, the small fish, sardines. What are the other smaller fish? Anyway, the smaller cold water fish, they don't have a lot of mercury and they're really high in omega-3 oil. So fish is okay. For people who are vegan, then you have flax seeds, chia seeds, and not much else. You have to be careful of things like, they'll tell you that walnuts are high in omega-3, but they're high in omega-3, but they have more omega-6 than omega-3. So they're not going to help your ratio very much. That's really, whereas flax seeds and chia seeds will help your ratio. That's the difference.
All right.
Oh, so we were going on what kinds of supplements. So you don't need, so if you know you need supplements, then yeah, take those, that's fine. But really just start with the kit, start with the book, and go through the book and assess yourself, how you're doing in each of the various things. How's your diet? How's your exercise? How's your stress levels? What kinds of things can you do for each one of those if you're not doing well? And then some of them you will be doing well.
All right. Roy said, sometimes when I get stressed, I can feel some chest pain. My doctor has done EKGs and a cardiac stress test, and there's nothing wrong. On my last EKG, he told me that at some point I had had a heart attack, but he did some kind of marker test and said that it was a false positive. What am I missing with my occasional chest pain with stress? And is there anything that I should be doing different?
That is a great question. Okay. So what you're experiencing may be something like Prinzmetal's angina. Prinzmetal, that was the name of the doctor that described it first. And what it is, it's the stress response. It's an emotional stress response causes a release of adrenaline. Adrenaline causes vasoconstriction, the constriction of the blood vessels, narrows the blood vessels going to your heart so that you have less blood flow to your heart. Your heart's going, hey, wait a minute, I have to work here and I'm not getting enough oxygen. And your heart's building up lactic acid. And so you're getting this pain in your chest because of the lack of oxygen getting to your heart muscle. And then you go into the doctor while you're not particularly stressed, not having the vasoconstriction, and the doctor says, everything's fine. There's nothing wrong with you at all. Now, don't take that as everything's fine. These are the people that they're having chest pain. They go into the doctor, do a stress test, and while they're running, it doesn't happen because they don't have vasoconstriction while they're running. It only happens when they're stressed or when they have, emotional issues or whatever. So they go to the doctor, get a perfect, clean bill of health, right? You're clean. Your arteries are clean, no problem at all. But they're at a higher risk for having a heart attack. So don't just brush it off and say, well, because I did the stress test, I'm clear. That is not a good measure of being clear at all. If you're having chest pain, there is a problem, and you need to deal with that stressor somehow. Deal with the emotional part, and that's part of what we discuss in the book too, is how to do that. You're muted.
There was a comment here. The good thing is it eventually tells me on screen that I can tell you're trying to talk, but it's on mute. Gerald had mentioned the rabbit example suggests that massage is really healthy. And do you have thoughts about that?
Oh, absolutely. Touch. It doesn't have to be massage. Just being caressed, being touched, being close to someone, hugging. Hugging is huge. It's really good for you. Massage would be great. Any way you connect with people makes a big difference in your stress level. There was a study done by a psychiatrist, and his conclusion of the study was isolation kills. That was the whole conclusion of this very large study. When people are isolated, they get, if it's not heart disease and dying of a broken heart, because 60% of people die of a broken heart where their blood vessels constrict and shut off the blood flow to the heart, and then it just stops and they die. It's not due to cholesterol deposits or clots in the arteries or anything like that. So yeah, that's really big. Yes. So massage, do it.
What about connection with animals? Some people are older, single, family not around.
It works both ways. Thank you, Cheryl. That's beautiful. It works both ways. The lab assistant that's petting the rabbits is also getting love from the rabbits.
Good. Christine says, how do you understand the test results if I get the omega oils test?
Okay, so just make it simple. You want your omega-6 to omega-3 ratio. And this is just a ratio, and they all do this. No matter if you get the Boston Heart one or the Quest one, they all come up with, they'll have a whole bunch of other things, and that's all just a bunch of junk. The important part is that omega-6, omega-3 ratio. and that ratio should be around between 2 and 4 is a pretty good place to be. Lower is better, and gosh, I wish I had that study here. That lower is better, and we don't know the downside. We don't know. So everybody in the United States is around 9 to 1. 10 to 1, up to 14 to 1 is considered normal in the United States. But if you go to a place like Greenland or Asia, in Japan, where they live on a lot of fish and they eat fish every day, they have a 2 to 1 or 1 to 1 ratio, and they have 10% of the heart disease that we have in the United States. 10%. We in the United States have 10 times as much, not 10% more, 10 times more heart disease, deaths from heart attacks in the United States than in like Greenland, for example. So we don't know the downside because no matter where you go, the more omega-3 they have, the lower the heart rate. And then you go here, oh, more omega-3, okay, lower heart rate, lower heart disease. The heart disease just keeps going down. So if you can get your omega-3 1 to 1, that's probably better than 2 to 1. But even though I'll tell you 2 to 1 to 4 to 1 is a pretty good rate, it's not necessarily optimal.
Okay, I'm getting a lot of questions. If you guys can post those in the Q&A, that's, again, a little bit easier for us to manage those. But I have a message here from Susan that says, are you saying we're better off with high cholesterol? I'd love to get off statins, but whenever I do, my cholesterol goes to 260, and I feared it would continue to go up. What I'm hearing is that I should not be concerned. I have SVT, and I'm on calcium blockers. Thank you. Are you going to get a chart?
Yeah, you know what? I had to disappear for this one.
Yeah,
but I gotta tell you, you will not see this in a doctor's office because it is printed in a science journal called Nature Science.
Yeah.
And Nature Science is a science journal, and it's not a medical journal. So here's the deal. Look at the numbers here. Okay, you have the death rate over here, and that's a death rate. So 1 is average death rate, 2 is twice the average death rate. First 2, yeah. 2 is twice the average death rate, and this is the cholesterol across here. So the optimum cholesterol is the lowest death rate. So the high death rate is a lower cholesterol. As your cholesterol gets to look 120, you have literally double the death rate of 220. So if your cholesterol is 220, you have half the death rate of your cholesterol being 120. Okay, this is 12.8 million adults. This is not a small study. This is the largest study ever done. This is the single most reliable study ever done. All of the other studies show the same thing, but it's not as clear. This is clear that your optimum rate, no matter whether you're male, female, no matter what your age, there's this 220 is consistent across all age groups on all types of people. That is the number to so you want your cholesterol, but even like 260, look at 260 is not that bad. It's up a little bit, and yes, you ideally would want to bring it down, but you're worse off if you're 180, for example. Your death rate is higher at 180 than it is at 260, right? So this is if you want to read it, it's Nature Scientific Reports. Is that backwards to you?
Nope.
It's backwards to me. So yeah. So yes, you want your cholesterol to be around 220 to 240. That's like the perfect place to be. But even if you're a little outside of that, that's okay. But you don't want to go too far outside of that, because that's where you start seeing the higher death rate.
Okay, Connie says on my last blood test, my cholesterol count was 155. Listening to your webinar, how do I get it higher?
Get it higher. Yeah, I've heard that. How do I get it higher? That's a really good question. And the answer is, I don't know. I've had patients that are like 120 and I show them that and they're like, oh my gosh, I'm going to die. How do I get it up? And I don't know. I don't know that you have to get it up. But clearly if you're higher, you don't need to worry about it. But if you're lower, do you need to worry about it? Well, certainly don't take any cholesterol medications or anything that's going to lower your cholesterol. And I don't know, maybe you need more, maybe you don't have the right kind of fats. I don't know. I don't have any research on that, so I can't tell you.
Yeah, interesting. Good question. Peter says, what about tuna fish mercury levels? Is that the same?
Now, it depends on the type of tuna. So the larger tunas like albacore tuna does have more mercury. The smaller ones, so kind of look at it this way: the smaller the fish, the less mercury that it has. Just because the larger fish has had to eat a whole lot of smaller fish to get larger and has concentrated all that mercury from all those smaller fish into itself. That's kind of the way it goes. So, yeah.
How do you get rid of mercury? Oh, sorry, Leslie. How do you get rid of mercury
Oh, good question. Good question. So I have this guy with, 50 times the upper limit of normal of mercury. And I'm looking, how do you chelate mercury? So it turns out that if you do intravenous chelation of mercury, that it mobilizes mercury, which means it takes it out of your tissues and makes it available to like your brain. And it does more harm than good. So it's not a good idea. So here's the way, and this is brilliant, and it's not that hard. It's really easy to do. There's two things that will take mercury out even better than an EDTA chelation IV treatment. And you never have to put anything in your veins to mobilize mercury, because all it does is take it out of your intestines. So you excrete gallons of fluid into your intestines every day, and whatever mercury happens to be in there is going to be reabsorbed unless you eat chlorella, which is a blue-green algae, or cilantro. And cilantro is actually more effective. So people who hate cilantro, you can take pills or something, because there's actually a genetic defect. I say defect because I love cilantro.
I do too.
You can take capsules of it also, and that's okay. And what it does is, in the intestines, in all that fluid that's going through your intestines to digest your food, it's binding all the mercury, holding onto it, and so you poop it out. So it gets rid of it. And so it's not mobilizing anything in your blood or in your tissues. It's just taking it out, what's already been excreted, into your intestines and not allowing you to reabsorb it. And so that'll just drop the mercury gradually. Yeah, you can break through the cilantro soap taste.
I know, I was almost going to ask you if you guys want to put it in the chat, let us know if cilantro tastes like soap to you, or if it tastes like, I don't know how to explain it, fresh. I think cilantro to me just makes things taste fresh. I don't know how to explain it, but it is one of my favorites. I could add it to everything, I think.
Me too. And that's what I have him do. So when my patient eats fish, he makes a cilantro pesto kind of thing and puts that on. And so he doesn't absorb the mercury. He says, okay, that was our agreement, that he says, I'm going to eat fish. And I go, okay, try this. And he liked it. So that's what he does.
Very cool.
But the blue-green algae capsules work too.
Jill says, what about taking Plavix post-stent after a 97% blockage to prevent a blood clot?
Yes. So Plavix is okay. Plavix is essentially an expensive aspirin. It's a platelet inhibitor, which is what aspirin does. So yeah, people can take aspirin. Is there an advantage of Plavix over aspirin? Well, they say no, yes, maybe no. Sometimes doctors will put you on both Plavix and aspirin because they don't know which to use. But the research shows that Plavix and aspirin together are a bad combination, because now you get the side effects of both of them, there's no greater benefit by adding the two of them. So yeah, if you got to stay on Plavix, you got to stay on Plavix. But once you've had a stent, now you have to be really careful because you can clot that off because that's not a natural blood vessel anymore. Remember, on the inside of the blood vessels, you have that lining called the glycocalyx that just allows the blood to flow really nicely. When you put a metal stent in there, then what's happening is kind of like a spring, and it's got metal in it. That allows the blood to stick to it and can cause clots. So you need the blood thinner to stop that from happening.
Okay, there was a good question here. Okay, Robert was wondering if we could write out the first two products that you mentioned about reducing lipoprotein A. Was one nattokinase?
Nattokinase, lumbrokinase. Those are
Okay.
that's an either or. That's an enzyme to dissolve clots. And that helps because the lipoprotein A prevents the dissolution or the dissolving of clots. And then the other one was increasing your omega-3, decreasing your inflammation so that you don't make clots in the first place.
Okay, I think I spelled it right. I think I've written this a few times, but I'll look it up just to double check. Kinase.
Kinase, yeah.
Okay. Tom says my wife has endothelial dysfunction. She takes a prescription for it. She has chest pain if she walks too fast. Anything that will help her?
Yes. What she needs is something called nitric oxide. Nitric oxide is something that relaxes the blood vessels and allows them to open up when you exercise. And so it works locally. So if you're running, the arteries in your legs will open up because of local nitric oxide that's made, opening up the blood vessels to allow more blood to flow into your muscles, because you need more muscles or else what? They're going to cramp up, right? And so that's where that chest pain comes from. And that also is true of the heart. If the heart needs more and they're not opening up the blood vessels, then you can get chest pain from that. So a really good one is to take Viagra or Cialis. I know everybody thinks of that as some sex drug or something like that, but really they're blood pressure medications. That's how they work. They work on the blood vessels. And that's the reason why men get erectile dysfunction, is because their blood vessels aren't functioning and they're not getting the nitric oxide and they're not opening up the blood vessels. And that's why they can't get an erection. So guess what? That also works in the rest of your arteries. It's not just there locally. It works actually in the entire body by dilating the blood vessels and allowing that flow to open up and flow naturally. So that's something that I have several people who are on that who have had congestive heart failure and are actually able to exercise and build up their heart by using that medication.
Jerry asks, how about reflexology? Is that good for us?
If it helps with lowering stress, it's wonderful. So reflexology is something that is looking for specific in areas of the foot, specific like pain centers that indicate, well, this area of the foot is something that indicates you have a liver problem or a kidney problem or something like that. And ideally, by stimulating that, you improve the blood flow so that you heal that organ or whatever in the body. And so if it works that way, I think it's wonderful. I think it's great. Yeah.
Let's see. This is a good question. Jim had asked, what do you suggest we put flaxseed meal and chia seeds in as food? Cheryl, you might have some ideas for this too. I think you're good about using your chia seeds and stuff like that.
I put it in yogurt first thing in the morning, 2 tablespoons, gives you 10 grams of fiber. Easy. Sometimes you can put them in water, let it sit for a little while. Even when you put in yogurt, you have to wait 5 minutes for it to kind of gel up. Or you can just put it in water. It is kind of weird to drink, but it's good for you. And then you can put them in smoothies as well.
I like it in, they used to add it to that Synergy kombucha. I don't know if that one's still around, the chia seeds, and they're kind of gel. I mean, I think it's great.
If you like boba tea,
Yeah.
that's kind of like a gel. You can drink chia seeds.
You can probably add it to oatmeal. Lots of things, I suppose. Smoothies. Dr.
Yes.
Saunders, do you put that in your smoothies?
I put it in my smoothie. I put flax seeds or chia seeds in my smoothies. And someone just said they have like granola with flax seeds. Granola. That's what I do that too. I make my own granola and I put a lot of flax seeds in it. So what Cheryl said is 2 tablespoons. That's really good because each tablespoon has like 2 grams of omega-3 oil. So that's actually significant.
Yeah, don't just sprinkle, measure. It's more
Yeah.
than you think,
Right.
but it's worth it.
All right. Is high blood pressure hard on the kidneys? Steve would like to know.
It's kind of the other way around. When your kidneys are failing or having a hard time, then the blood pressure goes up. So it's not, think of blood pressure as a symptom instead of as a disease. We've been told for so long that blood pressure is a disease that I had somebody call me this morning on the way to work, and he said, my blood pressure went up to 200 over 120. I've never seen it that high before. Do I have to go to the ER? And I said, no, you don't have to go to the ER. I said, calm down, relax. Gave him some things to do, things that we've been working on. I've been working on with him. So, and he's supposed to do a test, but then he took some stuff and now he can't do the test. He has to wait another day to do the test. So the blood pressure is not the problem. The blood pressure is the symptom, but it is a symptom of a problem. And there's over 100 different reasons why your blood pressure could be elevated. So finding out which of those reasons the blood pressure is elevated will help you to know what to do. So if you have failing kidneys, or if you have a constriction of blood vessels to your kidneys, if the arteries are constricted going to the kidneys, then your blood pressure will shoot up. It'll shoot up a lot. Then you have to fix the kidney problem and your blood pressure will come back to normal. If you have an adrenal problem, then you fix the adrenal problem and then your blood pressure comes back to normal. So look at blood pressure as an indicator, as a symptom of something else, and then find the cause of that blood pressure elevation.
Here's a good question from Jill. Actually, I have a couple of questions in here about how can we reduce inflammation?
Good question. Okay. That is huge. It's a really big thing because
we need to tackle
inflammation.
that on an entire webinar.
Yeah, we really do need to tackle
I'm gonna
that.
write that down.
So let me just go put it in briefly, where inflammation comes from. Inflammation is caused by damage of some kind. So if you have an infection and that infection is doing damage, so let's say, for example, you have a virus. The virus gets into your cell and then uses the cell to make more viruses and then breaks the cell open and scatters its viruses all over so that they can go into other cells. And so they're breaking open all these cells and they're caught. And then your immune system is going, oh my gosh, there's a lot of damage being done here. We got to fix this. We got to find. So then you have to make antibodies and clean up all those viruses that are all over and take out the dead cells and all that stuff. That's all what inflammation is doing. If you don't have an infection, let's just say you have something else like oxygen-free radicals are being made. Well, why do you make oxygen-free radicals? Well, for burning energy. Wow. So this is huge. If you're burning 60% fat and 40% glucose, then you have a low oxygen-free radical production. Why? Because fat is a slow burning, low energy fuel that is not as hot as glucose. So glucose makes more oxygen-free radicals. So if you're getting towards diabetes and your insulin is high, insulin tells your cells, don't use fat for energy. So now you can't use fat for energy. So now you have low levels of fat being used and high levels of sugar being burned. And that high level of sugar is burning hot. So it's like running, premium gas in your regular gas car. then it's going to run hot, and your engine is not going to last as long because of all the excess heat. So that's another source of inflammation, is just the energy production. If you don't have enough antioxidants in your diet, then you'll also have more inflammation from energy production. And that's just normal, even from fat. You've got to have vitamin E, vitamin A, astaxanthin, zeaxanthin. What are all those? Those are the colorings. So if you look at vitamin A is carotenoids, right? What are carotenoids? Well, carrots. The orange color in carrots is beta carotene. That's a carotenoid. And leaves, yeah, we think of green leaves as they're not various colors. Yeah, but leaves have carotenoids in them. The green is caused by the magnesium, but they also have carotenoids in astaxanthin, zeaxanthin, and all the antioxidants. They have a lot of antioxidants in them. Colored vegetables, if you're looking at, peppers, yellow peppers, red peppers, and all the different colored things in your diet, the color itself is something that takes out oxygen-free radicals so you don't get inflammation. So if you eat low levels of those in your diet, then you're going to have more inflammation. So let's see, we talked about, okay, and then the other one we've already talked a lot about, and that's the omega-3 to omega-6 ratio, and that's a huge one too. So just right there, there's 3 sources of inflammation that you could change.
That was a really good question. Thank you for asking that. I have a question from Rosaria. What does Dr. Saunders think about the cholesterol injection that my doctor said I need to be on? The different pills I tried, my body had a reaction to them, so now he put me on this injection. I'd love to know your point of view.
I don't know what your cholesterol is, so I can't speak to yours, but remember, you want your cholesterol to be right around 210 to 250. If you're right in that range, that's your lowest death rate right there. So keeping your cholesterol in there is a good idea. Now, if your cholesterol is 350 or something like that, then you might want to use that injection, and that might be a way to deal with it. But make sure your cholesterol is in the optimum range first before you decide whether you want to use that or not.
Okay, lots of questions left. Okay, is willow bark a good substitute for aspirin?
Yeah, it is. As a matter of fact, I had somebody who was extremely sensitive to aspirin, which is acetyl salicylic acid, and the salicylates that are in willow bark were easily well tolerated, and they don't cause the stomach upset. And so the woman that I saw this morning, she's totally able to take that for headaches and has no issues with the willow bark.
And then here's another big question. Sonia says, are there suggestions to improve fertility in women?
Absolutely. So, okay, this is a heart disease webinar.
Yeah.
Not a fertility webinar. I had a message one time that was sent to me from my office staff that was, Mrs. Jones would like you to help her get pregnant. And so I wrote back, we don't provide that service here. Okay. So the best thing for fertility is a circadian rhythm. So get a book called Fast Like a Girl. And what it is it's not just fasting. She talks about fasting. She talks a lot about fasting, but it's not what it's about. It's about hormones and how to regulate your hormones so that your cycles are right, so that you can ovulate and get pregnant and have normal pregnancy. So, she indicated that she had patients that's worked on, and I've had patients that's worked on. So I've seen it happen. Someone who was trying 15 years to get pregnant, and I put her on the circadian rhythm fasting, and within 2 months she was pregnant. So, it works. So get that book.
I think it also has a workbook as well. I'll post a link to it.
Yeah, there may be a workbook. I know there's a web, what do they have? A group.
Oh,
Yeah, whatever.
sure. Okay. Ted says that I had 2 stents placed 5 years ago. Should I continue taking low dose aspirin?
I would. You know what? Yeah, I think that's a good idea.
Okay. Jim says, what do you think about the YouTube videos I've seen that suggest getting rid of fluoride in our toothpaste and mouthwash because the bacteria that produce nitric oxide are killed off by fluoride?
Oh, that's interesting. Well, there are a lot of good reasons to get rid of fluoride. That's not one that I've ever heard of, but that's interesting because iodine, bromine, fluorine, there is no bacteria that can survive those. So that's why they use, bromine and chlorine in water and pools, and because, it kills everything, kills the algae, kills bacteria. So yeah, and fluoride does too. But I personally don't use fluoride in toothpaste. I don't think it's a good idea. I don't buy it. We use the natural ones that don't have fluoride in them. And for a lot of other reasons, because fluoride also replaces iodine, which is really important for your thyroid function and for women breast function and that kind of thing. So since iodine is so important and fluoride can affect iodide, and bromide does too, by the way. So those are in the same family, and so they affect how the iodine functions. And iodine is so important. So yeah, I would just get rid of it for fluoride.
I actually filter mine out of my water too, my drinking water. There's I don't know how these are all related, because Julie had said, does that lining grow inside the artery, possibly with a stent?
Oh, the question is a really good question, and that is, do the endothelial cells that repair your arteries when you have a stent, does the endothelial cells cover over the stent?
Mm.
And there's some evidence that in many people that does happen. And so why did I say take an aspirin? Well, because you have a place called a nidus that can start clots. And once you start a clot forming, then that's where heart disease comes in. And that's why stents are not an answer to heart disease. Stents, there's no evidence that stents prolong life. Every study that's been done, the long-term studies have shown that whether you get a stent or not does not change your life expectancy. What they do is decrease chest pain. So if you're just looking at chest pain, then that's the advantage of stents. The disadvantage, of course, is now you have a lifetime stent in there that you have to deal with. And I think anticoagulation, to some extent, there's a reason you had to get the stent put in the first place. And now you have a place that easily makes clots. So I think anticoagulation, but if you get your omega-6 to omega-3 ratio into the 1-to-2 range, you probably wouldn't need any aspirin.
Interesting. Juliet also asked about ginkgo biloba. What is the benefit of that?
Ginkgo improves circulation generally. It's an herb, and it works differently. So we were talking, the nitric oxide, it helps dilate the blood vessels, it helps circulation, especially it's useful for the brain. And so studies in dementia and people with microvascular disease, ginkgo biloba is really helpful for that.
Okay. All right. Thank you so much, Dr. Saunders. We'll see you
You're
next
welcome.
week. This was a great webinar. Good stuff. We have a lot of questions left, so I apologize that we couldn't get to all of them. They were so good. So come back next week. We appreciate you guys. 2 webinars next week, one on type 2 diabetes, and then this one as well. If you want to register or make sure you're registered for both at bartonwebinar.com. They are free, and Dr. Saunders is on both of those to answer your questions. So thank you, Cheryl. We'll see you next week.
All right.
Bye, guys.